You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, breast surgery, what you need to know. Hot topic. In fact, we have one of the most popular board-certified plastic surgeons in San Diego on the show today. So if you're not happy with the way your breasts look, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. My first guest has been getting a lot of attention over the years because of the results he gets with his patient, board-certified plastic surgeon in San Diego, Dr. Chasen. Dr. Chasen, welcome to the program.
Well, thanks for having me, Randy.
Now, before we get into today's topic, tell us a little bit about your practice.
Well, my practice is 100% cosmetic surgery.
Okay.
And I would say that it's a higher end practice. I've been doing this for 15 years, and this is, plastic surgery is all about experience. It really is. You can't.
Is that right?
Yeah. When you finish your residency, you're competent, but it takes years to develop the exact sutures you want, the team that you have, training your nurses. It's a team sport.
Now, we invited you on the program to talk about breast surgery, but you do everything. I mean, facelifts, tummy tuck.
I do the full spectrum of cosmetic surgery, and that includes, facelifts, tummy tucks, liposuction, breast surgery, and rhinoplasties. Realistically, in all honesty, people don't realize this, there's only 12 surgeries I do. When you count them all up, that's about what you do. Now, most of us plastic surgeons who do cosmetic surgery do those, but then there's a few things that I do in addition. And we're going to talk about the breast surgery today and revisionary breast surgery and fixing poor results with breast augmentation, fixing poor results with rhinoplasty. Those are two specialties.
You told me that on a consult, on the phone. I kind of liked the feisty part about you talking on the phone, that sometimes you see a consult, and this is a revision, somebody, I guess, that already had that, and you say, boy, I could have done that better, or that could have been done better.
Yeah, you know what? I'm a craftsman. I'm particular about what I do.
Craftsman?
Well, I mean, for example, people don't look in surgery in these terms.
Okay.
But if you go to a home, a beautiful home, okay? You go to a beautiful home and you see this wonderful bullnosing and everything matches. You see great stonework. You see how the inlaid, how those stones are inlaid perfect. I appreciate that, okay? And you know what? That guy who's ever doing that stonemason, that's the guy I want to do my house. And I feel like when I do plastic surgery, that's how I am. Everything has to look good. And when I see other surgeons and I see some work that I say, it's less than that.
Okay.
It bugs me.
You're hard on yourself about this.
I'm my worst critic.
Because you want to be the best.
Absolutely.
You don't mind saying it either.
I don't, because I hold myself to a very high standard.
Okay, now your background, your training, I mean, plastic surgeon, board certified.
Correct.
Did you always know you wanted to be a plastic surgeon?
I didn't. I knew I wanted to be a surgeon. My dad was a family practitioner. I knew I didn't want to do that. I knew from early age I wanted to be a surgeon. And then when you go through your surgery training, you get exposed to lots of different types of surgery. And, like cardiac surgery. When I did cardiac surgery, it was exciting and big cases, and I liked that. And I liked the challenge. But it became very boring. Bypass, bypass, valve, bypass, bypass. And it was the same thing, where in plastic surgery, every nose, every breast, every facelift is different. You're dealing with different tissues. And you can look and say that you get that immediate gratification of seeing an unbelievable job. You say, right on the table, that looks awesome. And that kind of feedback, and each one's different. So every day.
So you love it?
I love it. I never get bored. It's challenging. I love it. And I was a picky kid. And as an adult, I'm lucky that I found a job, a passion that requires you to be picky.
Okay. Now we're talking about being detailed, but with breasts, isn't it, for the most part, a straightforward surgery? I mean, is there that much to it?
There's a lot more to breast surgery than people realize.
Okay.
There are no people who are perfectly symmetric, okay? And that's the problem, is that I see these women who are 40 years old, and I'm examining them, and I point out their asymmetries because no one looks at their breasts as much until after they have breast surgery. And you point out this nipple's higher, this crease is higher, this breast is a little bigger. Your chest wall, your right chest wall is more anterior than your left.
Okay.
And that's the first time they've noticed that in their entire life. So people don't realize that. And so when I evaluate a breast, it's not the breast I'm evaluating. I'm evaluating nipple height, I'm evaluating size disparities, I'm evaluating chest wall discrepancies, because everybody's got them. Even the most perfect breasts you can imagine aren't perfect.
So your goal is to make them just right or balanced after the surgery.
Perfect as they can within the constraints that we're human.
So what are the different categories of breast surgery patients that you see?
Well, there's really 3 or 4 different categories.
Okay.
The first is just a standard breast augmentation, and that's a pretty wide spectrum from the young 22 to 26-year-old, never had kids, who just wants to wear a t-shirt without a bra.
Okay.
Wants to wear a cocktail dress and not have to wear.
Is that what they tell you on the consult?
Yeah, they
as
just
far
want
as their
to say,
motivation.
That's a lot of them say, I don't want to be big. I just don't want to have to wear padding. I just want to wear a t-shirt and not have to wake up and wear padding. Or I want to wear a strapless cocktail dress. That's all I want. I want to fill up a bikini. Those are very common statements I hear.
Okay.
The next most common, or just about the same, is the mom. I breastfed my babies for 6 months, a year, and I just want to get back what I had. I mean, after breastfeeding, there's something called post-gestational involution. Okay, what that means is after you breastfeed, the breasts go away, okay? And a lot of these women who had breasts, they've been sucked dry, and they just want to get back what they had. So those are the 2 most common categories. The next most common is those people who've had kids or their breasts have drooped. So now you're looking at either a lift or augmentation with a lift.
Okay.
And then the next category is people with very large breasts and they want a breast reduction. Okay. So those are the biggest 3 categories.
And redos. I mean, you're a big redo guy.
Yes, and that's the next category. It's people who've had a couple either breast surgery done poorly. That's one problem. They can have breast surgery done well and then have a problem. Or they could have had surgery done well and then they had kids, weight gain, who knows, something in their life, and their breasts don't look great.
Are all breasts, by the way, no matter what, I mean, over time and all the working out's not going to help them, they're going to drop. Is that right?
As long as we live on Earth. Now, as soon as we start, living on the moon, then we won't have that. But
it's mainstream. I mean, it's become mainstream. I wanted to ask you, is it the #1 procedure, or is it liposuction still? I mean, what?
It's seasonal, and I would say liposuction is still more common than breast augmentation, but breast augmentation is a close second. Okay.
Let's start with the augmentation. And I have questions over the muscle, under the muscle, where you place your incisions, what type of implants you use. So we'll start with
I'd love to answer all those questions. And over the years of doing, I think I've done about 1,600 breast augmentation procedures. So you get to know what works, and I consider myself a very pragmatic guy. If it works, I'm going to do it. And I see, and doing revisionary breast surgery, I see all the problems. And so, #1, since the FDA approved the silicone implant for general use in November of 2006, I pretty much exclusively use silicone implants.
So you like the silicone?
Yeah, why?